Now, this could possibly affect you. There's a deadline this week for thousands of Long Islanders to sign up for the New York State Health Exchange alternative that's being offered because of a failing health exchange, Health Republic, that's going to close its doors come the end of this month. And joining us now to talk about this growing confusion over having to change health plans on the New York State Health Exchange, part of Obamacare, is Samel. He is with JayMar Insurance Company on Long Island, and welcome to the show.
Thank you so much.
First of all, explain for folks out there what exactly has happened with Health Republic.
Yeah, I mean, it's kind of wild. Originally the government created co-ops. Part of Obamacare was a creation of these co-ops all across the country
to offer affordable insurance for many of the folks, and then maybe the lower to middle income.
Right. Yeah.
And it was partly subsidized by the government.
It was partly subsidized. There were hundreds of millions of dollars that were subsidized to these co-ops.
They gave them loans.
They gave them loans, and then they decided, oh, you know what, we're just kidding. We're not giving you those loans. We're going to take them back and give you only 12.5% of what we promised you. And then
let me explain that a little bit. Health Republic is the one we're talking about.
Yeah.
It's one of 23 that were set up on the exchange.
Second largest insurer on the exchange.
Of those 23 co-ops, 10 have already failed. Yep. Health Republic walking off owing $265 million to the federal government in loans because it was subsidizing them. And then over $100 million that it's lost in just 2 years. Can't pay the claims. There's all kinds of medical and health providers saying they don't know if they're going to get paid.
Well, listen, I mean, part of Health Republic's business plan was to lose money for 3 years. They knew that they would not be financially stable and to be able to handle their own weight for 3 years. That was part of the business plan. The CEO was talking about it about 6 months ago in the New York Times. So they expected this. New York State knew that this was going to happen. The federal government knew that it was going to happen. That it would take them 3 years to become financially stable.
But nobody expected them to shut down before the end of the year when everybody's trying to figure out their insurance now to cover them for 1 month just in December.
They shut them down.
And what is the state telling folks to do? Because they're telling them they have to sign up by what date now again?
Well, now they have to sign. They have to sign up now by November 15th. These Health Republic people.
So that's a week
in order to cover them for December 1st. But only 4 weeks ago, they told them that they had till the end of the year. And then all of a sudden, this past a week ago, they came out and decided, you know what, we're just kidding. We're not giving you to the end of the year. We're now going to give you till November 15th in order to sign up.
What happens if someone doesn't become aware of this and doesn't sign up?
People are not aware of it. It's insane. I mean, the New York State of Health put out letters. Health Republic put out some letters. But funny enough, that it's my insurance agency and our sites in New York and Long Island, Obamacare.com, that some of the first people to tell people about this. They call us constantly and say, why didn't we know about this? Why didn't the state inform us about it? Why weren't we informed?
Well, it's not just this issue, because there's also a new essentials plan that the state is putting forward that's kind of taking the place of what these co-ops were offering. And people are complaining that it's limited choice. Explain, what do you think of that essential plan?
The essential plans, prior to essential plans being in existence, people between 138 and 200% of the federal poverty level, which makes up a good percentage of Americans, 35% of the people that went to the marketplace to get a plan were offered these cost-sharing reduction plans. Just like a plan that anybody else was able to get that made more money. Now they're stripping away those plans from that. They're saying you can't have the plan that you had before anymore, and instead we're giving you these more smaller networks, more Medicaid-like plans.
If you want the lower cost, otherwise you got to pay more for.
Otherwise, you have to pay full cost
premium. So now this runs into what the whole point of Obamacare was supposed to be: that you wouldn't have to change doctors, that there would be affordable options. Is that still true?
Well, there's definitely still affordable options for many Americans. I mean, there's subsidies available, especially in New York. There's some fantastic subsidies available. There's still some cost-sharing reduction plans for some lower-income people, and there's still some good options out there. But losing Health Republic in the marketplace has certainly decreased the competition.
What's happened at your insurance agency with people who come in? What are they telling you?
Oh, I mean, they're frustrated. They're upset. They're angry. For the federal government to take away their best insurance option, where they've come to know and love their doctors, the hospitals that they have. Memorial Sloan Kettering, Stony Brook University Hospital. Health Republic was the only one that was covering both of these. Now people at Sloan had zero option on the exchange, cancer patients.
So now if they do get the paperwork done in the next week, how do they handle their deductible? A lot of people meet their deductible during the year and then schedule their medical appointments for the end of the year, hoping that the insurance company will pay most of the cost.
Well, now you have a new deductible.
A new deductible? That doesn't sound fair.
It's not fair. None of this is fair. It's not fair for the federal government to say, hey, you have these great plans, and then hey, no, we're shutting down these great companies.
Well, they say they can't,
because they're not for-profit insurers.
They're saying they can't afford all the losses, so they're only going to pay like 12-13% of the losses.
How can they afford the losses if the government promised them a certain amount of money, and then all of a sudden decide, nah, we're just kidding, we're not giving you that money?
Well, we're moving into that season, and we're beginning to hear calls from people. Even our previous guest, Gwen O'Shea, says that her company is going through this. They lost coverage through Health Republic. We thought about bringing her back on because she has a story of woe to tell of dealing with this sudden emergency situation for people who had Health Republic. Jason Samel dealing with it over at JayMar Insurance. Thanks for giving us a heads up on the upcoming deadline and letting people know that they're really going to have to pay attention if they want to get good coverage come the end of November and January. Thank you, sir.
Thanks so much.